In this video, we're going to talk about male breast cancer. We're going to make it simple by just making the differences obvious between management of a male versus a female breast cancer. So for diagnosis, treatment purposes, and management, whenever there is a male breast cancer scenario, it's usually the same as a female breast cancer. So in your head, you can just think of managing a female patient and your answers would be correct. However, there would be some differences that I'm going to mention them to you. Number one would be breast conservative therapy. In men, it's way harder to do a breast conservative therapy or lumpectomy. So the usual right answer is to do mastectomy. So that is one difference. The second would be when in women we do lumpectomy, we usually give them radiation. So in case of men, since we usually do mastectomy, you don't necessarily need to give radiation. I understand, however, that if the tumor is larger compared to the breast tissue they had, or you're concerned about the margins or adherence to the chest wall, you can go ahead and give radiations. The answer is correct either way. Third point is the genetic testing. In men, always get genetic testing. Fourth, know the differences for the BRCA mutations among men and women. For BRCA1, the risk for women to have breast cancer is 60 to 80%. In men, it's 1 to 5%. For BRCA2 in women, the risk of breast cancer is 50 to 70%, and in men, it's 7%. For BRCA1 in women, they have 20 to 40% of chance that they can get an ovarian cancer, whereas in BRCA2, just half that, so it's 10 to 20% chances of ovarian cancer in women with BRCA2. In men, they don't have ovarian cancer, so the reciprocal tumor would be prostate cancer. For BRCA1, there is majority of the data suggests that their risk may be equal or slightly higher than the average population, whereas in BRCA2, it's about 25% high risk. So that's the other difference. Fourth, again, if you have ER/PR positive tumors in men or women, treated the same way, give them tamoxifen, and if they are HER2 positive, then trastuzumab. So the management is different for those receptors. Thank you.